Hello, good morning everybody. Thank you for coming back watching my YouTube channel. I am back with another video. One of my viewer, he asked about NMC English requirement. Currently, what is the NMC English requirement? And then I thought, okay, we'll talk about it a little bit because it's a hot topic nowadays. So let's start the video without any further delay. So first and foremost, I would like to say a big congratulations, and I'm happy for the people who have passed their OSCEs, and then for those who are preparing for the OSCE, good luck. I wish you all the best. So for NMC English requirement, guys, it is still the same. We need IELTS or OET band 7 in each, but writing 6.5 is accepted. And see, if you're doing OET in writing, it is accepted. So it's still the same. However, it's been announced that they're gonna review the English requirement for the healthcare professionals, because it's getting into their attention, because that a lot of nurses, a lot of doctors, they are struggling to pass their English test. And then if you're working in any English country, and you talk with the patients, you talk with their family members, you talk with your colleagues, so I think it's just you know what you're doing, isn't it? So you know how you speak, you know how you write, you can understand and speak English language. So I think maybe that's why they thought, okay, let's reduce the score a little bit. But it's not yet reduced, it's not yet done. They're gonna review it at some point, and then we will keep you updated what is the procedure, what is the band score that they have reduced to. So stay tuned. If you like this video, guys, please subscribe, give it a big thumbs, share it with your friends. So without any further delay, we will talk further about it and what is the requirement, how they're gonna assess it in future. If they reduce the score, what will be their requirement. First thing I said earlier is IELTS or OET. The band score is still the same, but you can club it. You know that already. You can club it, and then the result should be valid for 2 years. It is usually valid for 2 years, isn't it? So, and if you're doing clubbing, it should be within minimum of 6 months that you need to sit for 2 exams. And if you get one lower score in one particular topic in reading, writing, or whatever, you can club it with the other one within 6 months. And the second thing they're gonna do is they are going to include, and they are going to ask for the evidence like pre-registration nurse, pre-registration midwife, or nursing associate program, whether it was taught in English or in any other language. If you were taught or if you studied in English, well and good, you may be in their list next time. So they're gonna consider it, and then they will see, they will ask for the evidence if you've been taught in English, and then 75% of the clinical interaction with the patient, service user, or family members, or your colleagues, they're gonna accept that evidence. So it will be in future at some point, and it will be reviewed soon. So we will keep you updated. That will be the second evidence. Now we have only IELTS or OET. The second one will be the pre-registration nurse or midwife or training, whatever you studied, whether it was in English or not. Next type of evidence they will be accepting, NMC will be accepting, is that if you practice in English speaking country for at least 1 year, you will be happy to be accepted in the program, in the NMC registration program. So if you work, such as like some nurses who come to the UK and they cannot pass their English test, and they are still working as band 3, or if they didn't pass their English test, they're still working as band 3. I know one of my colleagues she's still struggling to pass the English test, and she's still working as band 3. band 3, and you know, it's a big trouble when you are here. You are doing your best, and she does everything, honestly. Even the drugs in their ward, they ask her to do the drugs and each and everything, because she has passed her OSCE. She has gotten her pin, but it's not, I mean, she passed her OSCE. They're not giving her the pin because she didn't get her English test, but she's working same as us, same as a nurse, because that's her profession, that's her job. And she said in her words she does everything, but of course for the signing procedure and everything, she needs some supervision to sign the drugs and all these things. But she does everything, guys, and it's really bad if you're working at the same level as band 5 and you're not getting enough salary, you're just getting band 3 salary. I think it's not good. So if they're gonna review it, it's already been 1 year that she's been struggling. She's working as band 3, so I think it's a good point. If they are thinking to consider it in the future, it is a good sign. I mean, it's really good for some people who are struggling for the English test. It's not easy, especially the reading part, whether it's IELTS or OET. Some people get stuck in reading, because reading can be quite challenging. For me, I don't like to read. I don't like to read books. Sometimes I just feel like I should read, but I never read. I can read only 15 minutes and that's it. I'm not a person who will read. But if you like reading, you will get through it. Some people struggle in writing section. It's already been reduced, so which is good. But reading is the difficult point, guys. So I think it would be quite good idea to consider lowering the score in the future. And then 3 types of evidence they will accept if they are going to reduce the score, or if they're going to consider the things we talked about. So 3 evidence of the English test they're going to accept: IELTS or OET. Number 1. Number 2, pre-registration nurse or associate program, or if you studied in English and then you've been interacted with the patients, clinical interaction of yourself with the patient, with the family, with the service users. 75% clinical interaction, you will be happy to be accepted. You will be accepted in the program happily. And then the third thing is, if you have practiced in the English speaking country for 1 year, you will be there. You will be the next one to be included in the NMC registration program for your UK journey, for your nurse journey. So guys, we are very happy and excited about it. It's not yet finalized. Keep watching, and then you can also, if you have time, you can go through on their NMC website. You can check English language requirement. You can just type and then search it. If they have reduced it, for now it's not been reduced. So we'll keep you updated. Thank you for watching, and I'll see you soon in the next video. I hope you are happy and excited about this news as well. So let me know in the comment section if you are struggling with any particular point in the English test, whether it's reading, writing, whatever your weakness may be. But if you practice, you can overcome it, and we are just going to wait for the NMC to give us an update. Thank you so much for watching. Have a good day. God bless. If you didn't subscribe, please subscribe it. Like it also. Thank you.